October is Breast Cancer Awareness Month, and there is good news when it comes to treatment options. Dr. Stephanie Graff is the director of Breast Cancer Research Program at the Sarah Cannon Research Institute, and she has her finger on the pulse of what's at the forefront. As a leading breast oncologist and researcher, what is so exciting about recent breakthroughs?
So I think, Belinda, one of the most exciting breakthroughs that we've seen was this summer at the American Society of Clinical Oncology. We learned that the women with the most common type of breast cancer, which is hormonally driven, estrogen receptor positive, lymph node negative breast cancer, may not need chemo to treat their disease. And so there's so many women that are scared to do their screening or check out a lump because they're worried about what it might mean. And so often now the treatment can be pretty simple. It can be a pill and a surgery, and that's awesome for our patients.
I know a lot of people do look for non-invasive treatment, so that is the best news.
Yeah.
Maybe on the flip side, some negative news. There could be 250,000 women diagnosed with breast cancer within the next year. Why is this number so significant?
So that number boils down to 1 in 8 women will get breast cancer in their lifetime. And although we tend to think, well, I don't have a family history, I'm off the hook, about 65% of breast cancer is sporadic, which means it happens without a clear reason, no family history, no other risk factors. So I just implore my friends and family and my patients and their family to do those screening mammograms. The best way to find the disease when it's small and easy to treat with the most minimally invasive techniques is when it's detected on screening rather than when you can feel it yourself.
So important if you can get early detection.
Yes.
So let's talk treatment. If you do find out that you have breast cancer, beyond the research, beyond the clinical studies, how has your actual treatment changed over the past few years?
So one of the things that I'm really proud of that we have at the Sarah Cannon Research Institutes across Kansas City is just this amazing team-based care. And I think really the heart of our team is our nurse navigators. And together with the breast surgeons and the breast radiologists and the medical oncologists, our clinical research team, everything down to nutrition and wellness coordinators and genetic counselors, we're all there to keep the patient at the center of their journey and their experience with the disease and try to make it as good as possible.
That's amazing. You said something that really sparked my interest. When you say nurse navigator or breast navigator, what is that?
So a nurse navigator, I think at Sarah Cannon is different from anywhere else where they use the term. Our nurse navigators are a patient's first point of contact. They help meet them early in this disease process, understand all the different connections that they're going to need, can help connect them with all of those appointments, facilitate second opinions for patients that need them, help make sure that they're connected with all the resources, and then follow them through that whole journey to make sure that at every step along the way they have the full support of literally an oncology trained nurse specialist. I mean, somebody who really is focused on breast cancer in particular for my patients, but for my partners managing other diseases. They're there for those patients, and that's huge. Coming somewhere where you have a navigator, you have an exercise therapist, you have a nutritionist, you have an oncologist that's going to connect with you in a way that really makes your care personal. Those things are really, I know what I would look for if I were diagnosed with a cancer and trying to find the best approach.
Dr. Graff produces that research at Sarah Cannon. Make an appointment for your annual mammogram to get screened. Visit hcamidwest.com/service/breastcare or call 816-823-0011 for more information.